Welcome to another episode of Medicare Industry Insider. Today, we are going to talk about the M3P Medicare Prescription Payment Program smoothing provision, whatever other name you happen to know it by, and a little bit about how this provision of the Inflation Reduction Act is going to be taken into effect in 2025, and all of the challenges that come along with that. It is something that is very likely to drive a lot of confusion with beneficiaries, with pharmacists, with many of your networking partners, and even with a lot of agents. So being educated on the prescription payment program is going to give you an edge this AEP as you talk to those clients with a high drug cost every year and start sharing this information to build value in your community. So with that, let's talk a little bit about what this program is, what it is not, how it's going to work, and how it isn't, because there are answers to all of those questions in this episode.
Yeah, so what is it? So the M3P program is a program basically lined out so that anyone can qualify. Anyone can opt into this program, and essentially it is to help smooth, which is also where the smoothing provision comes from.
Sure.
Smooth out the cost of that prescription throughout that calendar year. It is going to be an interesting thing as we dive into this of how it works. There's still we'll probably see a lot of confusion come 2025 because it does go into effect in 2025. And we will dive into how it works so that you are very knowledgeable and you can be an awesome resource for your clients, pharmacies, and whoever else you decide to talk to about this.
Absolutely. So starting with the basics, this program is designed to let folks amortize the cost of their drugs over the calendar year from whatever point they opt in through the end of that plan year. All Part D plans, including those embedded inside a Medicare Advantage plan, must offer this option. There is no opting out. They have to offer this, and they have to offer it to all beneficiaries. They can't deny anyone the ability to enroll in this program. And that is really the first point of confusion, because that means if all you take is $2 a month lisinopril, you can enroll in this, and you can spread that $2 out across the span of the year.
It won't be $2 by the end of the year.
It doesn't make sense to do that. It's not going to help most people, and most people know that. But even simple provisions like if someone is DSNP eligible and doesn't have copays in the first place, technically they could still engage in the smoothing provision. So there are some basic complications like that we are likely to see. People enrolling when maybe they shouldn't, or enrolling when it doesn't benefit them, all of which will drive up costs for the carriers. The first thing I want to talk about this, we're going to talk about how it works for beneficiaries in a moment, but in terms of how it works for plans, this is a major cost outlay. This has to come out of that 15% that plans are allotted for administrative expenses. That's the same chunk of money where commissions come from, where all other administrative costs come from. The cost of running this program, which, to be clear, every carrier is basically a payday lender now. They have to offer these loans to people at this financing option to people with no interest, no finance charges, no qualifications, no credit checks, and no one can be denied. So that is a big upfront cost that plans will be facing this year and that they will have to deal with in the future. But there are a lot of complexities on the beneficiary side as well.
Yeah, so once a beneficiary then goes to a pharmacy, so let's talk about the logistics of how to actually enroll. So obviously you talked about the loan. So how a person enrolls is they would actually reach out to their carrier, their product, their plan, and get enrolled. This is something, if you would like as an agent, if you see the value of it with that particular client, you may recommend that they enroll by calling up their carrier and getting opted into this program. Basically, when they go to the pharmacy, they will not know the price of their drug, essentially, which is the big part of the pharmacy. If they opt in, their pharmacy will say, great, here you go. They will fill the prescription for them, and they will not get charged at the pharmacy.
Correct.
The pharmacy then will reach out to the carrier. The carrier, like you just said, becomes a low-interest loan provider, will then have to bill that particular client for the price of that drug. This is where it gets hairy, though.
Yes.
Let's say you have a $0 Medicare Advantage plan. Now your Medicare Advantage plan is billing your client.
And to be clear, to add to the confusion, this bill is and must be separate from your premium payments. So many people on standalone drug plans will get two bills from
Yep.
their plan if they opt into this. And one clarifying point to add is that this program does nothing to actually lower someone's drug costs. All it does is spread those out
Smoothing
across
provision.
the year.
Yes. So how does that bill get calculated? Honestly, the easiest thing to do is use one of the many calculators out there through all the different platforms. But essentially what you need to know is the monthly bill is based on what you would have paid for your prescription, basically divided out by how many months you have left.
Yep.
And then if you go to the next month, they will take whatever is remaining from that first prescription that you filled, add it to that, figure out the new cost of the total prescription, divided by how many months are left in the year, and so on. So that's why we could potentially see the costs go up and up and up.
It's really more like a credit card bill than anything else. As you add to it, imagine it like a credit card bill that you have to pay off by December 31st, and that's the best way to describe
Yeah.
it.
I've heard that, and I've also heard that say you bought a new house every single month, but you have to have a deadline of December to pay for the house. You take out a mortgage every month. You still owe for the first month that you bought in January, the second house that you bought in February, the third house you bought in March. But the only good thing is, well, not the only good thing, but if you hit $2,000, which is the max out of pocket, that's when you'll get cut off. So regardless, the most you'll spend is $2,000, but you have to hit it by the end of the year.
And because of troop accumulation, many people will spend less than $2,000 to hit that max out-of-pocket amount. So at some point, they will hit their max out-of-pocket, and then the monthly amounts will truly smooth out. But until they get there, it can be a little hairy. The big thing to know is that until they hit that max out-of-pocket, those monthly payments will change every month as they continue to accrue more costs.
So I think that's a good point to bring up is it will change every single month, which means that if you are informing your clients on how much your medications cost or trying to help them through that, there will be a little bit more confusion now. And especially when they go to the pharmacy where the pharmacist may not be able to see exactly how much it costs either. So the only way
The pharmacist will not know what their monthly payment amount is because the pharmacist may not necessarily know what other fills are impacting the
That's
payment
true.
program.
Especially if they
They
go to
don't know
multiple
when you
pharmacies.
enrolled, how many dollars of that claim is. Really, as an agent, you should not be trying to calculate someone's monthly payment amount. You cannot guarantee that amount and should not unintentionally misinform your client. Unfortunately, that's when they're going to have to work directly with the carrier to get those numbers. And again, those numbers will change every time they fill a prescription.
Yes. So I think that's the big takeaway is if they are wanting to know how much it's going to cost, they need to reach out to the carrier. And unfortunately, that's going to cause, you were talking about where is this money coming from with the carrier, that's going to be additional people to answer the phone, additional people to monitor the billing with the carriers. So they're going to have to implement this entire division literally for this particular smoothing provision.
Absolutely. Now, for some people, it will be really beneficial. And let's talk about a couple of the triggers, for lack of a better word. If someone has a prescription fill that is in excess of $600, the pharmacy is required to notify them that this plan exists. It doesn't mean they have to enroll, but they've been identified as a high-need individual that is likely to benefit. So think of that as a good baseline for yourself as an agent. If you see someone who's going to pay more than $600 for a single fill, probably worth mentioning this to them. Now, right now, there is no way for you as an agent to help someone sign up for this plan at the time of enrollment. But once that plan is approved, thinking all of our AEP apps, the client can call the carrier once the app is approved and then enroll before January 1st. That way, when they go make their first fill in January, they're already enrolled. If somebody waits until they get to the pharmacy counter and the pharmacy tech says, hey, your bill is $1,100, and that client says, oof, I think I want to enroll in the smoothing provision, they're going to have to call the carrier and enroll. The carrier must process that enrollment within 24 hours, but that client is probably going to have to come back the next day for those drugs. So if they want to enroll, it behooves them to enroll ahead of time. Of course, if they get prescribed something in the middle of the year and they don't know what the expense is going to be right out the gate, that's where it's going to get a little more complex. But if you already know you have clients that hit the donut hole, that go into the catastrophic coverage phase, that's really the folks that I would work to identify as folks that might benefit from this program.
Yeah, there's quite a few people who probably would not benefit from this program, and I think that is just as important to educate your clients on as people who are. People who probably are not a very good fit for that are people who will not meet their true out-of-pocket costs in the year.
Sure.
Maybe you have low drug costs. You were mentioning the $2 drug. Maybe the drug costs are the same every month, and that just is very easy.
co-pays, yeah.
Oh yeah, that's super easy for that person when they go to the pharmacy. If it's late in the year and then they decide they want to opt in, that's probably not a great idea. If they're eligible for extra help, like you said, anyone can enroll, so they may not be a good fit for that. If they are eligible for Medicare savings programs or state pharmaceutical assistance programs, there's a lot of situations where you may not want that person to be enrolled, and it is important to educate them to make sure they know that anyone can opt into this. This is what this program is, but it's not a good fit for you, and here's why. So I think that is just as important as targeting the people that you do think are a good fit.
Absolutely. So once you get signed up for that program, once your client is enrolled in this, it becomes pretty easy. They go to the pharmacy counter. They don't pay anything at the counter. They get that monthly bill. And as long as they pay that monthly bill,
That's a good point.
nothing particularly bad happens to anybody. But if they don't pay that bill, they will keep getting those bills. They're not going to pay any interest or fees, even if they pay late. And they cannot be, this is important, they can't be disenrolled from their drug plan unless they stop paying their drug plan premiums.
I think that's really important.
It really
Because
is.
we've had a lot of people ask that question, is like, what if they don't pay? All it does is opt them. If they don't pay, they can get dropped from the Medicare Prescription Payment Program.
Correct.
They cannot get dropped from their drug plan.
So though that means that they would have to go back to paying at the pharmacy counter, but they can't be dropped from their plan unless they stop paying their plan premiums. If they stop making those monthly payments on their drugs, they'll just keep getting those bills. The carrier can eventually send them to collections and use normal legal debt collection techniques to try to recover some of that. But being medical debt, we know that it drops off in value pretty quickly and is really hard to collect.
Yep.
So unfortunately, that means that there's a big chance the carriers will be left holding the bag on potentially millions, if not billions of dollars in bad debt that, again, they're going to have to find a way to deal with.
Yes, that should be a lot of fun. So we've got that going on this year. If a person chooses to leave this particular program, they can absolutely leave it anytime. They just have to call up the carrier and opt back out of the program. That does not opt them out of paying any bills that they owe. So like you said, you've got to continue to pay those bills, but you get an option. You can either pay a lump sum up front, or you can choose to continue on with that smoothing and pay throughout the rest of the year monthly. That is a good option if someone's like, oh, this is it. I opted in. I didn't realize what this was. I shouldn't have opted in. Or maybe you as an agent target that person when they come in for one of their quarterly reviews. Then you have a conversation and you can help them disenroll if it's not the right fit for them.
Or maybe they have a prescription change in the middle of
That's
the
a good
year.
point,
They
too.
go off of an expensive drug onto a lower cost generic. There's lots of reasons someone might want to disenroll. It should be pretty easy. Right now, most carriers are telling us that the only way to do this is to call. In the future, people may be able to log into their client portal and enroll and disenroll and manage that process. A couple things about the actual payments themselves. Carriers are going to offer a number of payments. They'll send you, in all likelihood, they're going to send people a coupon book, and then they'll have additional options at that time if they want to enroll in bank draft or even credit card payments, depending on the carrier. Social Security deduction will not be an option for
Good
these
point.
payments.
The only other thing we want to mention before we dive into opportunities and who to talk to is if you change health plans, drug plans in the middle of the year, what happens? You basically end that particular prescription payment program with that particular carrier, and you would need to re-opt in once you move to your new plan. So it is something that's plan specific that you have to opt in.
And we don't see as much mid-year switching with standalone drug plans, but remember, 33 million people get their drug coverage through a Medicare Advantage plan, and we really commonly see those mid-year changes on those. So if you've got a high-cost individual that's using the payment program, make sure they know to re-opt into that if they do make that mid-year switch because of a move or something like that.
The only other thing we did not discuss is pharmacies. Obviously, if you are networking with pharmacies, you want to educate them a little bit as well. But pharmacies we already talked about how when they go to the pharmacy, the pharmacist will not know how much their drug costs. The other thing is they, because they're billing the carrier and giving that prescription to that client without getting any payment, the drug plan is responsible for paying that pharmacy within 60 days. So now this pharmacy is basically out of pocket for 60 days for a drug that they could have gotten paid for right then and there. So that is another risk that pharmacies are taking on this year. So we've got insurance carriers taking a huge risk and pharmacies taking a huge risk. And like Chelan said earlier, they can't opt out of the program.
Yep.
They all have to be a part of the program.
A pharmacy can't turn people away because they're part of the smoothing provision. That would, in all likelihood, go against their contract terms with the plan. So if a pharmacy doesn't want to work with people on the prescription payment program, they would have to opt out of their contracts with those Part D carriers. And of course, in a lot of areas, you've got maybe upwards of 60, 70, 80% of a pharmacy's billings come from Medicare patients. So that's not really a realistic option for most people, but that education will be key. A lot of pharmacists are going to get limited training on this from CMS, and it's not starting, didn't start until about September is when we started seeing the first inklings of that. So you've got a lot of folks that still are not really well educated on this. So as they're going to the pharmacies, people may be confused. Pharmacists certainly and pharmacy techs will likely be confused, but you've got a lot of opportunity to network with those folks and build those relationships. Even as we go into Q1, building those relationships, because folks are going to walk into the pharmacy and not know what's going on.
We had one agent who went to 2 different pharmacies and took some information about the smoothing provision and a lot of the changes coming up with the Inflation Reduction Act causing the $2,000 true out of pocket, and just educated the pharmacy. And within 1 week, he had 7 leads. So if you were looking for, this is one case study, but if you're looking for a networking opportunity, I think a huge value as an agent that you have is your resources, your education, your knowledge on this topic. A lot of, like you said, a lot of pharmacies give very, very little training on this. So you coming to them with information is going to be incredibly helpful for them, but also a networking opportunity if you're looking for a potential networking partner. The other ones you could talk to is doctors, ship counselors, caseworkers. We could go on and on with a giant list, but I think the big key is educating other professionals in your industry to make sure that they're aware of what's happening also, which is a huge value to yourself and networking opportunity.
And I think an important thing to note is, kind of how clients are going to know about this. Obviously, you as an agent are going to explain it to folks that you have identified, but if they expect more communication from the carriers, they're obligated to identify people who are likely to benefit and reach out to them. Most people, if they're currently on a plan and they're identified as benefiting, they'll get that notice in their ANOC. Many people will get a standalone letter if they're newly enrolled in a plan. So lots of folks are going to get that notification that they may benefit from it. So ask folks about their ANOC when you meet with them and make sure that you're notifying them of what these options are. And again, that pharmacy is not necessarily going to know much of anything in terms of what those monthly payments amounts will be. They'll be able to tell someone what the retail cost of a drug is, not necessarily what their copay is, because it's just going to pop up in their POS as $0. So what the actual amount that they owe to the plan, pharmacy may not necessarily know if someone's already enrolled in the program. So don't count on that, is what I'm trying to say, I suppose. So all or nothing enrollment, it really doesn't make sense for someone to try to say if they have their Lisinopril, but they also have like Jardiance or something more expensive, or like an Eliquis or a Xarelto or something like that. They're going to enroll for all of those drugs at once and then have that bulk of cost that is being amortized out over the year. And if they do default on those payments, if they for some reason get dropped from the prescription payment program and enroll in a different carrier next year, that carrier's not going to necessarily know that they have that default. The carrier can't stop them from enrolling in the payment program with that new carrier.
So they could potentially get debt from multiple carriers if they're switching around, which is a little concerning. So medical debt is a huge possibility that people could potentially rack up this year as well through this program. But with that, we will wrap up this episode. I think the biggest thing to take away from this episode, and I'll get your intake too, but change equals opportunity. And for the opportunity as an agent, it means education, being a resource for your client, be a resource for your community, including all your networking partners, being educated on this, and know where to go to find answers. But the biggest thing that we can tell you is if they're looking for the cost of their medications, if they're looking to enroll or disenroll, the answer is the carrier. They're going to have to
Yep.
call the carrier.
Don't overeducate. That's my biggest advice for this coming year is don't try to have all the answers because it's not possible to do so. Make folks aware of this. If you've identified folks that you think are going to benefit, direct them back to the carrier. That is going to be their best resource. As much as you may not like that answer, it is the answer this year. And focus on the things that you can do to help folks alleviate costs and improve their coverage. But with all this opportunity, we really need to get out in the community, make sure you're talking to those networking partners, finding that opportunity, setting up meetings with potential clients to explain this provision of the Inflation Reduction Act and use that to drive your growth into 2025. So with that, I hope you've gained a lot from this episode. We will see you on the next one here at Medicare Industry Insider.